Hi, my name's Holly. Welcome to 5 Minute Birth Classes. Today we are talking about supplements and this is part 2. So last section was all about folate in first trimester. This time we are talking about calcium and vitamin D, and these are really important both for general health as well as for the whole entirety of your pregnancy. So starting with calcium. Now, calcium is an essential mineral. It is found in our diet most of the time. So we're talking about dark green leafy vegetables, we're talking about dairy, we're talking about fish, as well as any calcium fortified foods, which is actually pretty common these days. You get, plant milk fortified with calcium, cereals fortified with calcium, things like that. Now, calcium is really easily absorbed in the body, and calcium is used by our bodies to grow and develop our muscles and our skeleton. Obviously, your requirements increase in pregnancy, as well as the fact that you're growing an entire human from scratch. So they have really high calcium and vitamin D needs. It's also a really important mineral for our cardiac muscles, and it's not something that's routinely tested for in pregnancy. But if you have any symptoms or any issues that might be related to calcium, it will be checked then. Now, when you're not pregnant, as a woman, your normal daily requirement of calcium is about 800 milligrams, and it increases 1.5 times in pregnancy to 1,200 milligrams or 1.2 grams. Calcium can either come as a supplement by itself or in combination with vitamin D or in a big multivitamin. So if you do need to supplement, there's a lot of options. Now, if you have any concerns or if you suspect you need your calcium tested, if you have any family history of osteoporosis, actually a really good idea to have a general practitioner or a medical professional that you see regularly just to kind of keep on top of that. Now, vitamin D, number 2. Vitamin D is actually needed for our bodies to absorb calcium, so they're really good buddies. Sometimes you can even just find supplements that are calcium with vitamin D. So vitamin D is really, really important. It's used in so many parts of our body. It's really important for our skeleton strength. It's really important for our mental health, as well as our immune system. Now, for a lot of people, if they're low in vitamin D, they'll get signs of depression. So it's actually really interesting to see how that works. Vitamin D is really important for your gut health and your mental health. Now, again, vitamin D is very easily absorbed. We get our vitamin D from the sun. So if you are able, if you live in a nice sunny area and you're wanting to boost your vitamin D, then bare arms or bare legs out in the sun just for 15 minutes a day. Obviously, be sun smart. Don't go out when the UV is above 3. In Australia, you just end up roasting and getting horrendous sunburn. Surprisingly, in Australia, even though we have so much sun, a lot of us are deficient in vitamin D, and that's because we have such good sun-safe practices and we slip, slop, slap all the time and just try to avoid the sun as much as we can. So it's easier than you think to be deficient in this in Australia. Now, vitamin D is something that is routinely tested at the start of pregnancy, and if you are low in this, it might again be tested later in the pregnancy. If it's something that you're low in your 3rd trimester, often your baby will be instructed to need supplements once they're born for the first kind of 6 months of their life. So when you're not pregnant, your normal vitamin D levels should be above 50, and when you are pregnant, they should be above 75. There's different guidelines state to stay on the 50 and 75 difference. In my personal opinion, and this is just me, over 75 is what I always aim for. Vitamin D comes from dark green leafy vegetables. It comes from fish and dairy. Egg yolks are really important. With the fish, think oily fish, think cod liver oil, omega-3s, salmon, tin tuna, things like that. Mushrooms, also the only vegetable source of vitamin D. And so if you need to increase your vitamin D in your diet, think about using those. If you need a supplement because your vitamin D is low, you usually get started on 5,000 units a day, and then it drops down to 2,000 units a day after a month of high supplementation, and then it gets rechecked. See ya.